Hello, my name is RJ Nickerson. We're going to be going over braced coughing, huff coughing, and clearing the superior segments of the bronchi today. My lovely assistant name is Alyssa. So we're going to first go over the braced coughing. Braced coughing is normally used for post abdominal surgeries, anything that went through the thoracic cage where they have to kind of suture it back. So to do this correctly, you're going to be really sore. We want to kind of monitor that. It's going to be our main symptom, but the goal with these coughing exercises is to keep the airway clear from mucus. And I know that the pain might be present at all times, but it's really important to get that mucus out so we can keep breathing in a normal pace. So to do that, what we're going to do today is I want you to always have a pillow. The pillow is going to be your best buddy for this exercise. So what I'm going to do is I'm going to hug that pillow to my incision. And what I want you to do, nice and slow, we're not going to go for a big breath in, but I want you to breathe in just through the nose. We're going to hold for a second, and then I want you to try to force that air out as easily as you can. I don't want it to cause immense pain. A little bit of discomfort is to be expected, though. So the goal here, breathe in, try to get at least one good cough out as we're doing that. Again, this is meant to clear those airways from mucus. So let's go ahead and have you practice that for me here. So we're going to breathe in through the nose. And I want you to forcibly kick out and cough. Good. Let's go through a set of about 5 of these. In. Good. And as long as there's no increase in pain, that's what I like to see. Again, soreness is always going to be present with these, just because you had your whole sternal wall kind of cut open here. But perfect. These are good exercises to do 3 to 5 times every hour that you're awake. Do you have any questions about that so far?
No.
No? Perfect. So we can get rid of the pillow. The huff coughing technique is going to be for a little bit more advanced patients who are not just acute out of their surgical intervention. So for a huff cough, we have a low level and a high level. What we're going to do for those is we're going to, kind of similar mechanism, I want you to sit up tall like you're already doing, perfect posture. We're going to come in through the nose, nice and easy. Then I want you to hold your breath, hold that for a long 1, 2, 3 count. This is meant to get the oxygen below all the mucus and kind of build up that pressure inside your lungs. And then we're going to let out again. Nice, easy let out. This should, if you have anything blocking your airway, should kind of clear some things out. So this is just the low level. I want you to breathe in. Normal breath. Hold 1, 2, and 3, and then we're going to breathe out forcibly. Good, so let's try that again. I want you to really try to expel that breath out. So we're going to breathe in. Good. 3, 2, 1, and force out. Good. If she had any mucus stuck in the airway that at a very acute stage, that would help clear that out. We're going to move into the higher level of huff coughing next. So this one's going to take we're going to take a much bigger inspiration in, or breath in. So what I want you to do is we're going to go again through the nose. I want you to breathe in as much as you can, and when you feel you've reached that capacity, I want you to take a big sniff in. Again, we're going to hold for 3, 2, 1, and this one force out as hard as you can, and that's going to really clear everything out. So let's go through another set of about 1 or 2 of these so we can get that mechanism right. Breathe in as hard as you can through the nose. Good. 1 more breath in, and let it all out forcibly. Perfect. So we're going to, again, similar to those coughing exercises, the brace coughing, I'd like to do huff coughing 3 to 5 times every hour you're awake, more if possible. There's not going to be any side effect from doing excess coughing unless you're having irritation on that incision. So we're going to try and do that as much as possible. Perfect. So those are our 2 breathing and coughing exercises. Next, we're going to be going over clearing mucus from the superior segments of the bronchi. To do this, I'm going to position my patient prone with a big bolster underneath her abdomen. So whatever way you like to lay down, and then we're going to, head doesn't matter. And then we're going to put this right here. This way we're causing some elevation. Let's actually have you scooch down more towards me. I want this kind of more on your sternal level. Good, right there should be fine. Position myself this way. So we are going to start with her right side. So what I'll have you do is I'm going to have you take this arm back towards me, lay it down along the table. Good. This arm is going to come up, and you're just going to turn your head this way. So we're going to start this way on the left side. I'm sorry, I'm just positioning her into the right. So to do this position is a good place to lay if she can be comfortable here for about 20 or so minutes, but not a lot of patients are going to be able to tolerate that. So for our session today, we're going to have her just work on a big breath in and then a big breath out, nice and slow. And what I'm going to do is I'm going to add a little bit of percussion into that area. So I'm going to start on this lateral segment of the mid-thoracic area, and as she's breathing in, I'm just going to apply a gentle percussion as she's breathing out. And we're going to go through this for about 5 or so minutes. I'd like to start lateral and I move more towards the center. The goal of this is to expel that mucus from those tiny bronchi on the periphery of the bronchial system to the main bronchial branches themselves. So we're clearing the mucus from those small branches where a lot of that oxygen exchange happens to the big one to allow for more mucus clearance. We can do the percussion method, or we can work on the more extreme percussion method where I'll have my patient breathe in heavily and then and push out as hard as she can. Good. So on that push out, I'm going to apply an overpressure percussion in that same direction that I was just talking about. So I'll have her breathe in again, hand placement like so. And then on your breath out, go ahead, and I'm going to push down like so. So we'll go through about 3 or 4 of these. Ready? In and out. Good. And one more time. And out. Perfect. We'll go ahead and we'll do the same thing on the opposite side. So I'll have you just switch your arms. Everything stays pretty much the same. Try to not get in the camera's way. Again, starting on this lateral segment, we're going to push in. So I'll start with just having her breathe normally as I add my percussion. And then we'll get into that more extreme percussion where I'm coming from this angle. We're thinking about superior segments. We want to be up a little bit more by the shoulder blade and pushing down into those main bronchi. So I'll have her breathe in. And on the exhale, go ahead. I'm going to apply my percussion force. Do that one more time here. And out. Perfect. And that will be our quick overview of superior segment clearing with braced and huff coughing techniques.